thinking of owning your dream homes, EJ Investment is here for you. Secure our quality bungalows with 2, 3 or 4 bedrooms, or our story buildings 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
All right.
Honey, did you remind him that the last time he sent the money, it was not enough to buy all the provisions?
Oh, sorry, I forgot to tell him.
Are you guys talking about money transfer to buy provisions?
Yes.
But don't you know about Baloo?
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 What is Baloo?
Baloo is a service that your son can use to send provisions directly to you guys from the shop. And you don't have to worry about the exchange rate.
Tell me how Baloo works.
It's very simple.
Just log on to baluo.com and shop, or download the app on your phone. You can shop on the website or using the app to buy online basic products for your family and friends. With Baloo, you decide what your money is spent on. Your money, your choice. Buy online products for your family and friends in the Gambia, Senegal, Nigeria or Mali. Baloo, better than sending money.
Thank you very much, everybody, for being here. And first of all, I would like to express my appreciation to the Ministry of Health for organizing this session, which is timely and necessary. People want to be briefed regularly about what's happening in the nation, and this is a proper thing to do. I think we have to do it more frequently so that people don't panic with the rumors that are circulating. If there is no official channel of communication that people can trust, the other alternative will be people to trust or any information that comes from any source. So this is a proper thing to fight any wrong information that circulates today, and also update the public about what government is doing. So this is really highly appreciated. What I would like to say is actually globally, from WHO perspective, globally, as you can see in the WHO website, the data is available. The cases in China are showing a decline, while the number of countries that are reporting new cases outside China are increasing. And in the African region, in WHO, we have 2 types of African region. One is the continental Africa, but in WHO organization, we have part of the continental Africa belongs to the Eastern and Mediterranean region. But in the continental Africa, there are 3 countries that reported a case. These are Egypt, Nigeria, and Algeria. These are the only report we have within the African region. But the preparedness effort is going on, and WHO is supporting countries to prepare for this eventuality. The most important thing that we have to do is to prepare ourselves well, so that in case tomorrow we have a suspected case or a confirmed case in the Gambia, our systems would be able to cope and handle that in a safe manner without spreading the infection to the general public. So with that respect, I think we are supporting the government. And recently, about a week ago, 2 weeks now ago, the preparedness plan has been drafted. And I think it's, from the information I have, it will be finalized by middle of this week. And after that, it will be the time for action. Actually, the time for action shall not wait for even completion of the plan. We should continue rolling. And the other thing I think that I'm also informed is that there will be also a weekly stakeholders meeting, which even the media are a part of that meeting. You can come and get briefing about what's happening in the Gambia. That will be a good platform to discuss also where the gaps are and how to address them, including the partners will be present in those forums, in addition to the government sectors and different entities within Gambia that are supporting the government. So that's a good initiative that we should support and really keep. As you can see from what's happening globally, it's a matter of time. Any country can report a case or a suspected case at any point in time. So that's what we are doing. Currently, from the WHO perspective, there is a stock of supplies pre-positioned in Ghana for the Western African countries that can be quickly mobilized in case that we have an incident in any country. But in addition to that, there are also some personal protective equipment that will be receiving very soon for Gambia also to prepare for any eventuality. So this is happening at the same time, and the partners in the country are very willing to support the government, but we need to know also where the gaps are, and the government has to lead in this process. And we really admire what is happening currently, and we want to really support government and continue to support you. We are partners in here. There is nobody competing with anybody. It's just to make sure that we are prepared, to make sure that Gambia is ready to handle any situation that may arise. Thank you very much for your attention.
The reason why we are calling you now is to give you an update. As you know, over the weekend there has been a lot of noise with regards to information that has gone to the social media indicating that the Gambia has been registered a suspected case. We want to make it very clear that there is that information is false, and then it has not happened, and there is that even a particular person, the signs and symptoms that person possessed does not even get close to coronavirus, much more seeing that it's not even a suspect. We want to make it very clear to the public so that people can go out. But we also want to advise people that we also have 3 means of communication at the ministry. We have the website, I think the www.moh.gov.gm. You go through, you get our information. We also have the official Facebook page, which Minister of Health, the Gambia. We also have a Twitter page, and we also have a toll-free number, 1025. Anybody who wants information, you just get to that. You can even call the 1025, and then people will just collect it and then get the information and help us. But we want people to help us now. We want the media to help us. As much as we are working, if other people are also going around to try to frustrate our efforts, it's not going to be helpful. In as much as the country belongs to all of us, we have to work together. I mean, if we are trying to ensure that we are fighting to ensure that we don't register any single case of coronavirus in this country, but others are also trying to go around to undermine those little efforts we are doing. It doesn't tell well. And that's why, in a society you can have a group of people, 90% can be working towards positive side, and only 10% can work on the negative side. And that 10% can cause a lot of problem among the population. And that's what we have seen. So we want to appeal to all of you. If anybody wants any information, just come and approach us. We are going to give the right information from the credible source. And that's what, any information you get from these 3-4 sources, these are the credible sources for the Ministry and WHO, because we get our information from WHO. WHO give us information, we also look at it, and we also package it for the public. So that's why when this thing came up, everybody's concerned. So we want to appeal to all of you that let the population let them not be worried. There is no need for alarm, or there is no need for panic. There is no case in this country. The country is free, and we are definitely working very hard to strengthen our surveillance system in the borders. Right now, we want to inform you that we also have posted 9 public health officers at the airport, and they have started working today. They are on the orientation. From there, they're going to start work. We're going to have shift. Before they are posted, before they've been posted even, we have been having 24 hours round-the-clock shift. And we're going to be strengthening that now. That's what we are also doing. And we also have the same similar thing. We also strengthen our borders. 9 border posts have been strengthened. And we also have been supported with IOMs also supported us with capacity building, training of not only health workers, but immigration, customs, phytosanitary and other health workers. We have been trained from various border posts, and they were trained. And I think this is something that we are doing. And our borders also been strengthened in terms of sanitizers and other equipment. They've also been provided through IOM support. And WHO is now helping us, in fact, help us with a consultant to guide us through the development of a plan. And that plan is almost at the finishing end. And I think that is really what we are working on. But we are not saying that we don't have a plan and we are not working. We already have been doing something, but the plan will just come. Because we are looking at, as I said, the Ebola plan. We look at that. We don't want to reinvent the wheel. We had to go back and then we just look at it, review, and adjust it as necessary. And that's what we have done. So I think based on that, I think we look at the various components, and then we are working very closely in these areas. But we want to assure you that the media will be seen as a family, as a friend. Any information you need, just come to the center, or you call this, contact these pages I talk about, the social media platform we have in the ministry, or you call 1025, or you can easily walk directly and then come and talk to us. And sometimes we are also invited to cover our subcommittee meetings and even our national committee meetings. So it's also very helpful for all of you. So I really want to thank you on behalf of the Honorable Minister that he's also away, but I'm sure he'll be following our discussion. But he's very happy that we are having this meeting. And we also want to do this briefing on a weekly basis. So that this is the only way we can able to clear doubts and also to clear certain rumors that are also being circulated. So that by every time we come every week, we can be able to send another message or information which will be used by the public, so that nobody will sit at home and feel uncomfortable with regards to the issue of coronavirus. Because as you know, this weekend, many people did not sleep. Many families did not sleep, and it's also not good for our economy. You know, because people who are supposed to do certain businesses, they have to stop that. So because they feel that there's so it's something that we have to avoid. So we have to appeal to people, and our health workers also, we want to appeal to them. You know, any information they want to share, let them not use any other means of social media platform. Let them use our page, and then, or even call 1025 directly, or call the Health Sana Sambu's number and his team. They can call him and clarify, and Sana will give them the information. The EDC will collect all the information, give it to the health promotion director that will package the information for the consumption of the public. And that's how we operate. So it's important that we follow that line of communication. So we're very happy that the media is here. And I think I want to take on behalf of the Permanent Secretary and the Honorable Minister, and also on behalf of WHO, you know, it's my brother, you have been very helpful, on your behalf and all of the entire management of the Public Health Emergency Committee, National Committee, therefore declare this press briefing on coronavirus officially open, and also we'll listen to the presentations, and from there we can able to ask some current questions and we will answer them.
We need more mobility for our surveillance staff. Mobility is an issue since not every surveillance officer is mobile. Okay, like the airport, you have 10 of them. We're thinking about their upkeep and also to keep them moving. These are things which we have some challenges with, and we hope to work with our partners and to see how best we can address it as quickly as possible. My part of it, my major problem is community involvement and participation. People are taking a back seat and saying this is Ministry of Health property or Ministry of Health's job, not knowing that everybody in the community has a responsibility of taking care of your own health, much more the health of your country. So please, this is not a health responsibility. It is everybody's responsibility. Let's all look for relevant information that we need to be part of the preparedness and the response for the nation, not to throw blames on the health system. After all, who is the health system if not you and I? Everything is not health, but anything else without health is nothing. Before 2017, we've been struggling with so many outbreaks in the sub-region. Not only in the sub-region, in the whole world, in fact. Always events will override orders. We all know there is an outbreak of Ebola in Congo, and it has not still subsided. Now the world is carried away by corona. And I don't think corona is more deadly than Ebola. Ebola is equally a very deadly disease. I think because the reason to that I may not know, but WR and others are here. Why we are carried away from now, Corona to Ebola to Corona. But these are all diseases that we have done very, very well in kind of eliminating them. Eliminating them in the sense that we have moved them to a point whereby some of them are no more a major public health problem, like measles. This is why some of you are not seeing measles now. We are seeing something else, which is rubella. But even as I speak now, measles is kind of coming back throughout the whole world, in the Americas, in Europe, in Africa, even in the Gambia. We're having cases of measles, which we have combated so many years ago. Polio is also coming back, as you may know. There are diseases we targeted for elimination, but it seems they are coming back. There are others which are new diseases, like chikungunya and others, you can see. So the whole and the sub-region is really struggling with so many other epidemic potential diseases or vaccine-preventable diseases, okay? You can see yellow is all measles. The greens are all polio. These are diseases we don't want to see now. But the reason why they are coming back, well, experts are here. We can put our heads together and discuss. Last but not the least, you can see now is coronavirus, which is obviously detected in China. But as we can see now, it's spreading all over the world now. Africa has also got their case now. Next slide. This is just a snapshot of what corona is all about for those who miss our first presentation. I will repeat that these are a family of viruses that causes diseases in mammals and other birds. When we say birds, it's not only birds flying around. We also have all poultry and others. These are all categorized as bird family. Humans get infected when we get contact with those animals and birds. And then we'll pick up from those animals, meaning it's jumping species now. It's no more in the animals. Humans have picked it up from animals, and now we'll start spreading it from person to person. Exactly what is happening now. So when humans are infected, of course, we know it's a respiratory illness. You'll go through some form of a common cold. Of course, it's a common cold, in fact, but the most severe type. We already have other severe coronaviruses relative to severe acute respiratory syndrome, which has been circulating for quite so many years now. Middle East respiratory syndrome is another one as well, which is also another type of coronavirus family. It's also spreading. These diseases are normally spread, as I said, from person to person through respiratory droplets. What we mean by that is people who are infected by this disease are going to be coughing and sneezing. And when they sneeze and cough, they spread the organisms or the disease agents into the air. Anybody near these people will easily pick it up, or in close contact with these people will easily pick it up. But that's not the only way. That is droplet. Others will pick it up through contact. People who are already infected, as you can see, most of us, when we have common cold, we have nothing to cover our nose, we have nothing to cover our mouth and things like that. We use our bare hand to blow our nose and things like that. So our hands are going to be contaminated. Anybody who shake hands with that contaminated hands are going to pick up the infection. Likewise, you'll be touching objects and things that others are going to share, like door handles, even computer keyboards. And things like that. So anything that that individual touches is going to be contaminated. That's where others can also pick it up. Others, like health workers and laboratory staff, will pick it up from patients who are already admitted. If you are not putting on protective equipment, meaning you are going to pick up that infection and pass it to other patients, which we call cross-infection or, how do you call it, hospital-acquired infections, nosocomial infection. We contribute to transferring infections from one patient to the other. So this is why precautionary measures using protective equipment are very, very key as we talk now. Even not now, but for healthcare workers, they have to protect themselves. For the general public, for us to ensure that we reduce transmission of this disease is for us to exercise personal hygiene and sanitation. When you cough in public closing, even at home, make sure you cover your mouth and nose. Your hand is always contaminated. We have to keep on washing our hands consistently, not having it at one place and a one-off thing. Like people are complaining, we don't have hand-washing equipment at our borders. That's not enough. At the border, we can wash your hands, but immediately after the border, you're going to hold your nose again and blow it out. What is the use of washing your hand now? So it's not 100% protective something. People have to continue washing their hands. Hands get very dirty during the day. When you develop this disease, the symptoms we expect, when you are infected by this agent, as they get into your system, we expect you to show signs and symptoms of the disease within 14 days, 2 days to 14 days. This is why anybody we suspect, we'll keep you somewhere and observe you for 14 days. That's the reason for follow-up. But still, I cannot say this is 100% scientific. As you all know, this is a new disease. More research is ongoing. More information is still needed. These things may change overnight. Nobody knows, okay? But then we are going to observe for 14 days. After developing the disease, we expect to see signs and symptoms relative to a mild common cold or a severe type of common cold. We know when it is mild, you'll experience fever, there will be cough, there will be difficulty in breathing. Beyond that level, that's where we can detect very quickly. And you can see fever is the first thing. That's the reason why we have to take temperatures at points of entry. Anybody with elevated temperature beyond normal, we expect that something is wrong with you. We will not say it's corona, but we feel something is wrong. So we have to work with you and see how best we can find out what's the problem. There will be coughing and so on. And I don't think anybody will go through all those things sitting at home. You must seek for some treatment, okay? Beyond that level, if you fail to seek treatment, it is going into a severe form that is going to be just like pneumonia. And we know how deadly pneumonia can be. The country is still struggling with pneumonia. Pneumonia is one of our high prevalent diseases in the country, especially affecting children. You may also experience severe acute respiratory syndrome. What we mean here is, that's why the disease, we don't have a specific cure for it. Whatever you heard of a syndrome, meaning there is a series of signs and symptoms. So you treat whatever that manifests itself. This is why it's not specific to say you need this to treat this disease, okay? You have to try so many means. When it reaches your kidney, it may collapse. That kidney failure may cause death. Wherever your kidney fails, both of them, there's a likelihood you may not survive it. So this is why most of the deaths are recorded. This is the global picture, of course, and what is happening in China. Currently, we have over 80,000 cases, of which 79,000 are in China. And you can see deaths are also beyond 2,800 cases. 92% of those deaths and cases are all from China. So meaning China is the most affected country. But as WR says, transmission in China is kind of stabilized or almost going down. But the disease has been exported to other countries through international travel. Okay? That's the reason why we are also monitoring our borders very, very well for international travelers who may go to those suspected countries. But you can see almost 7,000 cases are now registered outside China, and the 58 countries are affected, including 3 in Africa, of course. And 104 cases also died, which are all, some of them are in Philippines. So as a sector, we are working with our partners, of course. This actually shows you that after establishing a National Health Steering Committee, that simply tells you that this is a multi-sectoral committee where all our partners, donor agencies, aligned ministries, the media, and everybody is involved. That shows you that this disease or health problems are beyond the health sector alone. Everybody has to be part of health. Health is everybody's business, okay? So you cannot sit down like Gambians. Anything that happens, they push it to the government. Oh, what is government doing? What is government doing? What is health sector doing? But you forgetting that you are part of that government you're talking about. We are the government. We have to work very, very hard and make sure that we work together to make sure we don't import this disease. As I said, a National Steering Committee has been established purely to be responsible for coordination and resource mobilization. And below that bigger group, we have technical groups. As I said, the ones on board above are purely for coordination and resource mobilization. Those not necessarily get involved in implementation. So the implementing arm are the technical groups that are listed, 1 to 6. And all of us within the ministry and our partners have to fall between one of those groups. I belong to the third one, which is the epidemiology and laboratory group. we go out to ensure that there are systems in place for us to rapidly detect this disease in the community, at the borders, in our health facilities, and everywhere. And I think people should know that they are part of this. We are all part of the surveillance system. We should all be looking for diseases and infections. Infections are not happening in my office here. They're in the community, and that's where we all come from. This is why everybody needs this information as to what are the signs and symptoms of any disease, so that whenever you see it, you have to report it as quickly as possible.
Do you have Gambians living in China? Because as he rightly said, they show a video from Uganda that is advising its citizens not to come.
Even not to go as well.
And not to go as well. So what message do you have for Gambians? Okay. Especially those living in China.
As I said, this is all about transmission. Even in religion, Islam, it says that wherever there is a problem, let nobody go out, let nobody go in. I think this is a very good way of kind of controlling transmission. And that's what Chinese are doing right now. The worst hit places are kind of now put in lockdown. A lockdown. Why are they doing this? Is to prevent the disease from exported to other countries. Okay? And they can make ways of controlling it very easily. Even whereas you check all those people in China who want to come back to Africa, okay? Even if they are not showing any signs and symptoms of the disease. As I said, scientifically, we still have to learn much about this. Bringing them here means we are importing the disease. You know what I'm saying? And at the borders, as I said, if you are not, you didn't fit our case definition, you didn't show any signs and symptoms of the disease, you are not linked to any contact, whatever it has to be, we cannot see you. You will pass our borders and come into the community. Maybe in the next few days you start developing problems. So it's not advisable for those people to come. Let them stay. That's why you have the capacity to address this problem. We don't have the capacity. Coming here, if you want to force your way, yes, you can come, it's your human rights. But when there is a calamity, who is responsible now? Is it the health sector? When people start dying? It is not us. The root of the problem is the person who came. The good Cameroonian says he is not coming. That's why he get the disease. If he is to die, he will die there. But he will not bring this disease to a poor resource country like Cameroon. They cannot cope. It's a proxy for people to get killed. So anybody who is forcing Israel to come back to us, well, I'm sorry, we are not doing justice to this country. We have very bad intentions for this country. Stay in China, when they detect you as being sick, they have the capacity to treat you. It's a superpower. We don't have those things. Why do you want to come home? In the first place. Those doing business, are they doing it for us or their families? You look at the greater implication. My family benefits from the goods I'm selling out in terms of money, but the country suffers in terms of health problems, which may supersede what we have already gained. So it's better we prevent now than defending human rights and all those kind of things.
So I don't need to add, but it's about the transmission, you know. There is no, you cannot tell exactly how someone got infection. It's very difficult. People may not even notice that they have a contact with a case. Like in traveling, you can travel through different routes and you may get into contact with different type of people, but you don't know. Maybe you are in a queue and someone is coughing next to you, you don't even realize that. But later on you develop symptoms. But you have never been to China, but that person has been in China. So it's very difficult, you know, to establish the linkage with the person who came from one. And the other important fact is also that now it's not only China. We have other foci of transmission also, where transmission has taken place, third generation, fourth generation, cases have been reported. So the infection can come from anywhere. It could be from Italy, it could be from anywhere. I think in Nigeria case it was from connected to Italy. So it's not from China only. China cases are declining and they have taken also stringent measures to confine people to a certain geographic area to limit transmission. One thing that I want to clarify regarding travel is WHO's recommendation regarding travel is emanating from International Health Regulation 2005 agreement, which does not promote travel restriction. But restriction of travel is at the jurisdiction of individual member states. And WHO has no role or cannot prescribe any such measures to be taken by a certain state. It will be individual states' decision. Because in the international health regulation, travel restriction is not recommended as a major way of really restricting transmission. Rather, preparing your systems to detect and handle the case and isolate the case and prevent further transmission. This is how it is. But the problem is emanating also from lack of capacity in some cases, and also in China, as you know, the mechanisms and the systems that are in place are amenable to this type of management, and they have a system of doing this, and they managed it. But I have not seen, I think in some countries they have managed also small quarantine states, areas, like in Italy, they have done that. So it's individual member states that will decide on those travel restrictions. So I want to clarify that. It's even the China recommendation, what China is doing is a Chinese government decision. It's not WHO's recommendation. So just to clarify that. Thank you very much.
So we want to advise you, if you want information, please always come to, just walk and come here. You'll get the right information. Or follow us on Twitter, follow us on Facebook, follow us, or just go to the website. And also, if you cannot come, just call 1025. Any information you get there, you can publish that one.
So what mechanism are you putting in place to address those?
No, we are telling people our source of information is central. Our source of information is central, and it's all at this level here. Health workers can give you information, but they have no right to give you information that is not validated.
To a newspaper.
On a newspaper.
Just like that.
Yeah, they cannot just, we don't want to advise them to be given information. They can. But they can go to radio station, but that also have to be approved at this level. On corona, it has to be approved. They know it. They know it. All the health workers who are talking, they know. If you want to talk to them, they'll say, hey, talk to so-and-so. They know. And we want to advise you, if your choice want to be credible, collect information from a credible source at the ministry.